Our emergency department was set up in a different time and place to serve different needs. And it's done very well since 1989 when we opened it. But the needs of those days are not the needs of today.
Several years ago, mental health was not recognized as the large problem it is today. The number of psychiatric patients that we're seeing in the emergency department has risen dramatically. In fact, there are some statistics that say that approximately 60% of the patients that we see in the emergency department have an underlying psychiatric diagnosis.
NMC Health is often seen as a last resort in the emergency department, but it's a trusted resort of the community who are in need of caring at a time of crisis.
It's hard. A lot of these patients come to the emergency room in crisis mode, whether it's because it's drug-induced or because it's situationally induced. They're here because they want help right now. And we can't get them the help until they come to the emergency room and they get the medical clearance that they need before we can even start with the psychological piece.
This renovation will allow us to take care of these patients, not necessarily just because of their psychiatric diagnoses, but for their other medical issues as well, and for other patients in the community.
It is not uncommon for us to have 2 to 3 hallway beds set up, and hopefully those patients can be taken from that hallway setting and put into a private room. It's hard to provide care in a hallway. You want to provide respect and privacy and still try to be timely, so finding that balance is difficult.
These environments, they're great for what they do. It's just, there is a component of safety in the sense there are a lot of wires and tubes and just very overwhelming for people. There's a lot of things that could pose a danger to someone if they are in a crisis and they're having thoughts of say harming themselves.
Everything has to get stripped out of the room. Where these new rooms will already be built that way. They'll already have a safe spot that we can just lock that stuff up or get to it if we need to and easily put it away if we need to.
Just having an area that's specially for them will make a huge difference. In our current setup, you have limited space and you're mixed in with people who are having heart attacks, strokes, dog bites, and so it just gets very, very hectic. And so this will give them a quiet place where they can kind of collect themselves and have the privacy that they need so they can help their loved one get through a very difficult time.
A modernized decontamination area is something we've thought about for quite some time. And now that we're adding on with our beautiful new ambulance garage, it's going to allow us to modernize those facilities.
It's literally created for if you come in with chemicals all over your clothes that we can rinse you off before you walk into the emergency room. It is not a shower room. It is an open space with a curtain. And there are times where we have to use that area and it just doesn't provide the privacy, nor is it really heated or cooled because it's kind of by the ambulance garage. But this new space will actually have a shower room, which will be nice. And it'll be nice for the psychiatric patients that are here for 6 or 7 days. We can keep them safe, keep them right by the new rooms, and be able to provide a shower to them easily, which I love.
With this expansion, we'll be able to provide patients, especially psychiatric patients, the situations where they can come into the emergency room and get taken care of in an expedited basis, but also be taken care of in a comfortable and supportive manner for them, keeping their dignity and making sure that the patients are getting the care that they deserve. Right care.
Right place.
Your health.
Our focus.